Next speaker.
My name is Ernestine Grant, and I live in Sacramento County, and I take care of my daughter Angie. She was involved in a hit-and-run accident 10 years ago that left her paralyzed, which is classified as a quadriplegic, and she cannot do anything for herself. So I'm her hands, her everything. So I've taken care of her. I had 25 years or more experience as a nurse. So when this happened, I quit my job to take care of her, because who better to take care of her than myself? So I plead to the governor to not make cuts, because we have tried allowing other people to take care of her with the things that the way you have to read or deal with her. And everybody doesn't know how she operates. So this, and allowing others to take care of her, has caused her to be in and out of the hospital or in the doctor's office on emergency visits, because of them not understanding how to take care of her and provide for her. She's even undergone unnecessary surgery that she didn't need, because of the medical staff did not know or understand how to take care and provide care for her. So I plead to the governor not to make these cuts or put a cap on our hours, but to find other ways and means to make his budget. Thank you.
Thank you very much.
My name is Benita Munoz, and I'm from Sonoma County, and I also take care of 3 people. And I have a son that was born with cerebral palsy, seizure disorders, and I had to fight to keep him alive. And now the governor wants to make it where more people come into my home to take care of him. And he's told me that he doesn't want anyone but his mother to take care of him. And my other 2 clients, they said, you know, they don't want anybody else in their homes either, because I know what their needs are and how to help them, and they don't want to have to start training people. So we're asking the governor not to make it where it's 40 hours a week, because we won't be able to survive. All of us live from paycheck to paycheck, and we don't make enough. You know, when my son asked me if he could go to the movies, I have to tell him, no, we can't go because we need that money for the bread or whatever. And so we can't afford to be cut, or we'll all be out on the streets in deeper poverty than we are.
Thank you for being here.
Thank you.
Hi, my name is Loretta Jackson, Sacramento County Home Care. I take care of my sister and also my father. My sister had an aneurysm on the brain and a stroke. My sister was placed in a nursing facility because at the time I didn't have room in my house, but we had to add a room for her. While she was in the facility for almost a year, she was raped 6 months. 6 months out of the time she was in the facility, day after day after day, the workers there, the guy that was working there was molesting and raping her. My sister can't talk. She can't walk. She couldn't do anything for herself. So she was screaming and hollering. And now me and my sister, we built a bond, but it's hard for anyone to come in and work with my sister, people, especially people she don't know, because of the fact of what happened to her in the nursing facility. And then also, because of the bond that we build now, I think it would be very devastating, and it would probably take her backwards if other provider or someone she didn't know would come into the home and try, because it was hard for us to get her to bath again. She didn't want to go in the water. She didn't want us touching her. She didn't want us trying to change her clothes or doing anything for her. So now that we built this bond and gotten back close with her, she's able to trust. She trusts me. It took years for her to trust me, and I'm her sister. I'm asking the governor to please find other ways to cut the budget, find other ways to fix the budget, to please think about what he's doing, especially those that can't advocate for themselves, that can't speak, that can't walk, can't do anything, that totally depend upon us. A lot of clients in here need, especially those that get 24 hours care. So ask the governor to please look at other ways so that he can make it better for home care providers like myself and others. Thank you.
Thank you very much.
Good afternoon. My name is Chris Brado, Sacramento. I'm a care provider for my daughter, Nicole. She's 29 years old with the mentality of a 1 to 2-year-old. I do everything for her. She cannot bathe herself. She's incontinent. The cuts, if these cuts go through our cap on our hours, I would be forced to go to look for work outside of the home to make my budget. I wouldn't be able to pay my bills, monthly bills. In turn, that would probably mean I would have to make the hardest choice a mother should ever have to make, and that's putting my daughter in an institution. And you hear the stories. My daughter cannot speak. She says one word, and that's mama. She doesn't make a good witness. So she can't point, that person hurt me if something happened. She can't describe the person that hurt her. And there's people that take advantage of this. They know that they can get away with it because my daughter can't testify. The in-home support services allows me to keep my daughter where she belongs, and that's at home, where I can give her the care and love that she needs. Thank you.
Thank you very much.
My name is Marta Cobos, and I'm a home care provider for my twins here in Sacramento. Misael and Lionel, as you know, autistic kids, they have no fear. They are really, they have a really hard time when they have changes in family, changes in the environment, any changes and new people coming to the house, in the routine. Then the life had to be predictable. There had to be predictable days and structured days. Coming new people to the house, new providers, they're going to cause a lot of distress to my kids because they're going to start seeing new people. They're going to get from nice and really well behaved to disruptive and aggressive. I don't want this happen because I've been working for more than 10 years on that, making sure that they are more independent, and I don't think this is okay. I disagree strongly with that proposal, and I'm asking to the governor to have more respect for home care providers. Thank you.
Thank you very much.
Good afternoon, Madam Chair and Member Tia Orr on behalf of the Service Employees International Union. You've heard from a number of our brothers and sisters today on the provider side and the client side, but we wanted to add just our concern about the administration from our IHSS social worker perspective. Obviously, SEIU represents the social workers who administer this program on your behalf. The governor's proposal will inevitably create such an administrative burden that it will delay assessments. It will delay eligibility. It will even potentially delay time cards for a lot of the providers you heard from today. So while you consider the testimony that you've heard from these compelling folks and people that we obviously love and respect, I hope that you guys consider administering this and whether or not the governor's proposal is actually something you can put into fruition on the ground that doesn't impact clients and consumers and providers even more. Thank you.
Thank you very much.
Hello, my name is Norma Olivares, and I'm here to share a statement on behalf of Francisco Godoy, who is an IHSS consumer from Sacramento. I'm a member of the In-Home Support Services IHSS Advisory Committee. Plus, I am the Vice Chair of the Board of Directors at Resources for Independent Living. However, I love to share some of my experience as a disabled individual. I will give you my opinion regarding the FLSA proposal. I am a C4 quad. I spent almost 9 years at an institution. The main problem I have and has been to find reliable and responsible live-in providers, PCA. I spent hiring and firing PCAs for over 5 years because they did not have experience, and some of them said, I don't want to be enslaved. I want weekends off. I do not do bowel and bladder care. Man, you need a nurse and maid, etc. Finally, I found a live-in PCA whom has been my provider for the last 21 years. I have another part-time shore worker for almost 4 years. What PCAs do for me, I require care 24/7, and to find responsible providers is like winning the lotto. Teresita, 21 years of experience, learned at UCD how to change my catheter, how to do physical therapy. In bed, I need to be turned every 2 hours, manage my meds, clip my toenails and fingernails, shower me, dress me, undress me, and transfer me with a Hoyer lift, shave daily, and brush my teeth, shared money for food, and she writes my checks, cooks, feeds me, and cleans, etc. With 40 hours a week, I may need 3 providers. However, if I hire another live-in, where will I house her? How will I pay for their food? Disabled individuals should be eligible for food stamps. IHSS providers perform missionary work. They deserve overtime pay. It is the law. Thank you.
Thank you very much.
Karen Kiesler with the California Association of Public Authorities, and also speaking today for the California Association of Area Agencies on Aging. Turning also to the administrative components of the governor's proposal, nothing can diminish the stories that you're hearing on the real impact this would have on consumers and providers. Public authorities are in 56 of the 58 counties, and one of our core services is providing registry services to consumers that need to find an extra provider. So we see really significant challenges with the governor's proposal. We think it's going to be very difficult to recruit the number of providers that would be needed for this backup system and for our registries, somewhere between 30 and 40,000 providers. Most providers who come to a public authority registry already work for a consumer, and so we could find that they would then cap out at the 40 hours, and so people that we've already got on the registry, we may not be able to have them be eligible. Matching is going to be very, very difficult. As Frank Mecca said, the system would have to be available 24/7. And then a couple of things that were not considered, I think, by the administration is that we would have to guarantee pay for some amount of backup providers. In San Francisco, where they have an on-call system, they send somebody out, and there's times that the consumer is in a locked apartment complex, the building manager won't let them in, or that the consumer refuses to let that provider provide care. The worker hasn't done anything wrong at all. So in San Francisco, our lesson is that they have a 2-hour guaranteed payment. And then a last point is that we think it's critical that the backup provider system and registries only be within our CMIP system. We've heard interest from contract mode agencies and also from the independent living centers who see this as a terrible situation for the legislature, worried that this could be adopted, and then envision potentially a role in providing backup services. But if they don't have access, as we do and the counties do, to CMIPs, they can be referring somebody out that's already hit that 40-hour cap. So there's a lot of things to consider. We see concerns with the trailer bill language. We'll address those with your staff, and thank you.
Thank you very much.
Madam Chair, members, Sarah Flocks from the California Labor Federation, and we represent 2 million union members in the state, and IHSS workers are among the hardest working, most dedicated workers in California. They work more than 8 hours a day, more than 40 hours a week. As we've heard, some work 24 hours a day, 7 days a week. Yet they do not get the overtime pay that every other worker in this state has a right to. California has always been a leader in protecting workers' rights. We have daily overtime, we have overtime for farm workers, we have all of the protections that has set us aside as a state. Yet with this proposal, with the governor's proposal, we are falling behind. We are falling behind other states, and we're falling behind the federal government because we are denying the right to overtime to the hardest working people in the state who care for our elderly, who care for our disabled, and keep them in their homes and out of institutions. And we strongly oppose this proposal going through. And I just want to give a silent hand clap to all the workers and consumers who came out here. Thank you all.
Thank you. Thank you very much.
Chair Corbett and member of the committee. My name is Chris Jensen from Resources for Independent Living. I introduced myself earlier. There's absolutely no way that I can advocate as well as what we've heard today so far, so I'm not even going to try. But we are in favor of paying the overtime and repealing the 7% cut. What I would like to speak to is something that may be in the weeds a little bit that we haven't talked about today, and that is for the first time, providers will be paid for waiting during doctor's visits, medical appointments. Those hours, minutes of waiting time will be subtracted from the service hours that have been allotted to the recipient, which can impact how much service they can receive, and the whole point is the service. So we would strongly suggest taking a look at trying to fund that in a way that will not impact service hours. All right, thank you.
Thank you very much. Very important points.
Good afternoon. My name is Christina Rockwell, and I come to you as a representative of California United Home Care Workers and as a caregiver. One of the issues that I'm encouraged that has been recognized repeatedly today is that many of our counties are very rural. It's very difficult to find enough staffing, so these individuals that require additional care beyond 40 hours a week would require more than one person coming into their home. Very difficult to do. I have a professional career working with the probation department for my county. I'm also a college professor, and I continue to go back to care for an individual that I had never met before as an outside non-family member caregiver, because every time that I remove myself from being his care provider, I see him finding himself in very grave and dangerous situations. Most recently, 2 days ago, I filed a police report on his behalf because he had been abducted, coerced into getting into a vehicle. He was gone for 9 days. He ended up in the hospital for 3 days after that for renal failure, severe dehydration, malnourishment, incredible financial fraud on his with his money. The thing that I'm also not hearing come up is that all of these individuals are Medicare, Medi-Cal recipients of some sort. They're disability payment receivers in order to be on IHSS. And I understand that there's going to be ideally a significant cut in the amount of money because of the overtime, while the governor is recognizing that that's at a cost. What we're not taking into consideration is the additional hospitalizations, like for this gentleman. The additional, many families are saying that they may have to turn to institutionalization because they can't continue to manage care in their home for less than the amount of the 40 hours of pay per week. So at what cost to the taxpayers is that still going to be that we're, these, costs that we're not recognizing right here at this table? So thank you very much.
Thank you very much.
I'm Carol Iman, and thank you for listening to us today. I also represent the California United Home Care Workers, and I know all of us have different stories. And for me, in 2004, my mother was killed in a car accident as a result of a drunk driver, which left my older brother, who is now 68, and he has the mentality of about an 8-year-old. My brother would be in an institution if I didn't take him in. Well, my husband and I raised 5 children, and we downsized our home, thought we were done taking care of and raising others, and then I got my brother. And so we had to take out a huge equity loan to add on to provide a home for my brother. So it would hurt me financially, and my husband and I, if we were to lose these much-needed hours. And for my brother, as an example for him, my mother overprotected him, and he was sheltered. And my brothers and I were never allowed to use the word retarded, or we would get spanked. And so my mom just was so protective of him. And when a social worker came to visit him a few years ago, she asked him if he could bathe himself or comb his own hair. And after she left, he goes, because he doesn't see himself, as retarded. And he said, "Why, that woman thinks I'm stupid. Why, and he went into a screaming crazy fit, which only I could calm him down for 2 days. And so I've given up a lot, and it's not easy. I've raised children, I know, teenagers, but now I have a brother who, whoever goes first, him or me, but he's my responsibility. And so my heart is not just for my brother, but I want to speak up for those that can't speak up for themselves. And so thank you for listening to us today.
Thank you very much.
Hi,
My name is Esther Rodriguez, and I'm a care provider for my father. And I would like to share my story. They came to live in my house in 2002, and at that time, after a week they were in my house, my father suffered a stroke. And then after that, he got dementia. He was unable to say what was his name and to take care of himself. And so I was supporting them, giving them everything they needed, shelter, food, clothes, everything, care. And then 6 years ago, my mother was very sick, and then we found that she had cancer. And even she was sick, she was my father's brain all the time. She was telling him, take your medicines, it's time to take a shower, don't eat too much, take care. And she was telling him everything when I was not at home, because I needed to work hard to provide food for them, everything, pay the rent. And my mother passed away 6 years ago. And then I needed to continue taking care of my father. And I've been doing it, but just recently when I was cooking for him, I needed to do something on the window, and I fell down. So I had a fracture on my wrist, and then after that I needed to have 2 surgeries. And it's been almost a year, and I'm waiting for a 3rd one. So suddenly the situation in my house changed a lot, because now I don't have the same salary that I had before, but I need to continue taking care of my father. So if we continue having those cuts, I'm not getting too much right now. They are paying like $400 for taking care of my father per month, just $500. But if we have more cuts, then that would affect me a lot. I really wouldn't like to put my father in an institution, because I know that he will be very sad and he will die sooner than he should. When I had the 2nd surgery, I needed to bring him to an institution because there was not any other choice. And I could see a change on him. He was very depressed, and he told me, do you know, honey, if you're tired to take care of me, then I will prefer to die, because I don't want to go never again to that institution. So that will really affect us a lot if we continue having those cuts. And thank you so much for listening to me.
Thank you very much.
Thank you.
My name's Teresa White, and I'm also from Koo. In 2004, my mother had a brain aneurysm. At that time, I was working as a chef in Los Angeles, and I had to come up and quit my job in 2006 because her husband walked out on her. She is left very short-term memory. If she gets infections of any kind, and you don't, the first year I didn't know what I was going to see. I didn't even know about IHSS at the time. But when she got an infection, all of a sudden she would be hallucinating, thinking she's going off on trips and everything else. We'd find out it was bladder infections. That happened several times until I finally made the decision not to go back to work in LA and to stay with her. And we had to put her in a facility for 1 week and get her meds straightened out. Because of being with her for so long, she also has cancer. We found out lung cancer and COPD, so we've been battling the cancer. But the way I know her so personally now, after going through all these bouts of infections and then going into hallucinations, I know her well enough to where I can see when something's wrong. I know exactly what might be going on, when she needs to go to the hospital before she ends up staying in the hospital, how her personality is in general. Nobody else could probably come in there without, she could end up in the hospital several times before they realized what was going on. She's always been a very strong woman. and her home is everything to her. These cuts will take all of this away. We live in a very small town in Plumas County. We have a small hospital. There's maybe 3 people on the registry signed up to be backups, and normally there's nobody available. I do not know how they would manage to get anybody in there to take over the extra 40 hours. And not only that, my mother would just be livid, and she would not last in an institution. So I'm begging you guys to look at these issues and make a good decision on not putting the cuts in.
Thank you very much.
Thank you.
Hi, my name is Vivian Denniston. I'm from Humboldt County, and I am an active COO member. 30 years ago, to my delight, I had a gorgeous baby girl. I like to call her Sweet Sarah. She is 30 now. Not long after she was born, I realized that she had autism and a seizure disorder. When she was 15, she had osteogenic sarcoma and lost her left leg. And during the course of her having chemo, she had early onset of schizophrenia. So in the past 30 years, my dreams and hopes for her have changed, obviously, drastically. She is my constant companion. I do nothing, I don't go to the store. I don't come here. It took 3 people to make today happen for me to be here. I do nothing without thinking of her first. How will she be when I'm gone? Who will take care of her? But now my dream for her is that she can remain in my home, and that I am her caregiver, that I do not have to have her out of our home because I have to get a job outside of the home, and that is what would happen if you did not allow us to work more than a 40-hour week. And now for her, she does understand that I might need to get a job, and she's frightened. That was never my hope for her, and never my thinking that she'd ever be afraid this would happen. And it's not fair. This is definitely not the life she wanted. She wanted to be like everybody else, all her body parts and brain working perfectly. So don't do one more thing to her. Let her stay in her home and let me take care of her. Thank you.
Thank you.